Thank you. Good morning, Aldrin, to you and the viewers. Yes, indeed, the MEC, Madoda Sambata, did indicate that an investigation will, be conducted. And of course, this, as you have stated there, comes after circulation of pictures where we saw babies in cardbox. But we see, health workers here, nurses and trade unions, demonstrating what they call a peaceful demonstration. And of course, they demonstrate this way, of course, after words uttered by the MEC. They are saying that a suspension was threatened. But to just hear more from, Bennett Mushwete from the Health Workers Indaba Trade Union. Thank you so much, Bennett. Just tell us about this demonstration. We can see card boxes here written, "I did not kill a baby." As health workers, just your standpoint after we saw those pictures.
Good morning. As we are here, we are nurses and all the other departments who are here. We are here because of the issue that was issued by the MEC, saying that suspension will be given to whoever is going to give suspensions. He said he's going to do the investigation, but yet he's saying he's going to suspend managers or whoever is going to suspend without any gathering what really happened on that day. And as nurses, we normally improvise to say babies cannot sleep on the floor, or we cannot put 3 babies on a crib, because that ward was overcrowded. The nurses in that unit had to make a means for those babies to be taken care of. They nursed them in those boxes. They didn't just leave those babies on boxes. If you can look one of those pictures, if you can look closely, one of the babies was all nasal prongs, of which was having a problem, respiratory issues. So those babies were taken care of by those nurses who were in the unit on that weekend. Yes.
The maternity capacity, or whichever ward that was, we understand that the capacity is said to be 25, but the MEC has stated that over more than 50 babies were delivered on that day. Just tell us about the resources here at the hospital.
When you talk about the resources, we are working in conditions that are not satisfactory. We are just coming to work, we are working under lack of resources. Here in the hospital, maternity direct patients to those babies who are not well, who are sick. Casualty, if the babies from casualty, neonatal, they admit to that side also. So in maternity, we are struggling. The surrounding district hospitals, the clinics, the self-referral, they do come here. And maternity at some point is overcrowded. Some of the babies come here to casualty as BBAs. BBA born before arrival. They come hypothermic, they come with a lot of issues. They are taken to neonatal unit. And in maternity, it's a staff also is shortage. Even that in NNU, there were 2 professional nurses, there were 2 staff nurses, and there were 3 ENAs on the floor, covering the 62 babies who are admitted. So imagine all those babies. That staff was not supposed to be covering those babies, all of them, on that day.
And the MEC has indeed also admitted that the shortage of cribs, I just want to find out, given that the MEC says that management was not aware that there's a shortage, is it for the first time that you see a hospital delivering more than 50 babies in a day?
No, not at all. Not at all. It's not for the first time. If I can take you to maternity, the stats, they were saying last month, or when was one of the doctors said, we delivered more than 400 and something babies in a month. So which that number is very high for maternity to deliver such a. And we also have challenges whereby the neighboring hospitals, like Galaxpan, theatre is not working. The patient from that side, Ottosdal, they come here. All of the surroundings, Zirast, General, they come here. If Galaxpan is not working, some of the cesarean section are being done here in the hospital. All of them that they have challenges. All the babies, the mothers who are pregnant, the one who have delivered, they come here in this hospital, and it's a challenge. There's a shortage of nurses, there's a shortage of equipment, resources, and all that. And even I was surprised to hear that the MEC said he brought those the cribs and incubators. Some came, we didn't see any incubators, only cribs that we saw on the day. But if the incubators, I don't know where they are. Even the staff from NNU, they can attend to only cribs that we received on the day, some cribs.
We understand that different unions, your union in the NOSA and how are meeting with the management as we speak. Of course, we will hear the outcome of such meeting. But just make it clear, what is it that you are saying as nurses and as different unions, pertaining to the investigation and, of course, any possible, where we would see possible suspensions. What is it that you are saying as unions?
Us as unions, we are united. The NOSA and how PSA, Haitu, and all who are here. We are saying that we don't want any suspensions. Hands off to nurses who the MEC says he must suspend. Let him do his investigation, get to what led to those babies to be admitted, the high number that was admitted on that day. Let him do investigation. He must account to say management, they must provide nurses with equipment. There should be enough staff. There should be enough resources for us, and not only in maternity, the whole hospital has challenges. Let it be that he attend to those things so that this thing may not happen again, because this is not the first incident happening. And again, there was an issue previously. This is not the first time suspending people, nurses. They did suspend DG and even the CEO last without even having proper investigation. And those suspensions were revoked a few days later to say nothing was reported to say why were they suspended, and the revoke of those suspension afterwards.
Thank you so much for your time. Of course, we will just wait for the outcomes of the meeting with the management and different unions. That was Bernard Moshwete from Haitu saying they do not want any suspension, confirming as well that they do not have resources, they are understaffed, and of course they are saying this is not happening for the first time. While people, some are enraged about the pictures they saw, Aldrin, these nurses are saying they did all that they could do at that particular moment, as they could not, make sure, they had to make sure that those babies are not sleeping on the floor. This is one provincial hospital where like he mentioned, different referrals from so many clinics in the Northwest province, and he is saying that it's quite a challenge when you have to talk about the capacity of this specific provincial hospital, that is the Northwest Provincial Hospital in Mahikeng. We will hear from the Department of Health as for how far the investigations, also talk to other unions. Once they are done, we understand that there is a meeting. We'll see if there's any consensus as far as their request saying these nurses must not be suspended.